Spend enough time scrolling, and the algorithm will eventually diagnose you with ADHD. Common behaviors like misplacing keys or zoning out are suddenly framed as clinical quirks, turning a complex medical diagnosis into a digital meme. This highlighted segment represents roughly 4 to 5% of U.S. adults. For these millions of people, those quirks are symptoms of a legitimate clinical condition that creates a significant, measurable impact on their daily lives. Getting a diagnosis as an adult requires navigating a medical paradox. The current DSM-5 mandates that for a diagnosis to be valid, symptoms of inattention or hyperactivity must have been present and persistent before age 12. This raises a difficult question. If these symptoms were actively present in millions of children, why did an entire generation of parents and teachers fail to notice them? A generation of adults is finally naming the invisible burden they have carried since childhood. Historical ADHD diagnostics were built around a specific stereotype: the loud, impulsive boy disrupting the lesson. Teachers were trained to spot externalized behavior, meaning if you followed the room rules and stayed in your seat, you were rarely considered for evaluation. This bias left millions of girls in the dark. Many presented as model students, using active engagement to mask their internal struggle. Their severe inattention often looked like quiet daydreaming, effectively keeping their intense internal cognitive friction invisible to the adults around them. Systemic biases further narrowed the diagnostic net. Black children exhibiting behavioral symptoms were frequently met with discipline rather than clinical support, effectively excluding them from a diagnostic system that wasn't designed with them in mind. High-achieving gifted children also slipped through. They used their intelligence to brute force their way through school, masking executive dysfunction with high grades until the mounting pressures of independent adult life became too heavy to manage. Adult life eventually demands more cognitive energy than a person can spend hiding a lifelong condition. While physical hyperactivity often decreases with age, it doesn't ever disappear. It mutates into a constant sense of inner restlessness. For many adults, this feels like a motor that never stops, driving racing thoughts and a perpetual state of mental exhaustion. This distortion of time perception is known as time blindness. The ADHD brain struggles to sequence events or accurately judge the passage of minutes, leading to chronic lateness and a recurring inability to meet professional deadlines. This manifests as chronic disorganization. Simple acts like starting tedious tasks or tracking belongings become major barriers that derail the day. The consequences ripple into personal lives. Emotional reactivity and missed social cues create deep friction within adult relationships and family dynamics. For an adult, ADHD is a systemic failure of self-regulation, impacting every setting of daily life. Clinical ADHD is a measurable neurodevelopmental condition, regardless of willpower or moral character. Managing it requires a multimodal approach. The evidence-based blueprint combines specialized therapy like CBT, organizational coaching, and medication prescribed by your psychiatrist or PCP. Modern telehealth has made the support more accessible. Practices like coping and healing counseling provide HIPAA-compliant therapy across all 159 Georgia counties, reaching patients in every corner of the state. Their team of over 15 licensed therapists is specifically built to be diverse and culturally competent, focusing on the very demographics that were systematically missed in childhood. Financial barriers are also being removed. CHC offers $0 Medicaid copays and works with major insurers like Aetna, Cigna, and BCBS to keep treatment affordable. You can move from masking your symptoms to actively healing them. Schedule a professional evaluation at chctherapy.com or call 4